Hi, I'm Ben Coker.
And I'm Brandon Willis.
And I'm Jared Hall. Adam Eaton.
And I'm Ben Fischel, and this is our Population Health and Homeland Security Semester 2, 3 credit hours, Baylor Bear, Best Practice Video. What do USAA, Valero Energy Corporation, Broadway Bank, and many other U.S. companies?
What do swans?
And donkeys.
And peaceful, refreshing waterfalls.
And some goats that we couldn't get a clip of.
And this beautiful campus all have in common?
They're all part of Health by Design, a San Antonio-based concierge medicine organization that we've chosen for our best practice.
So what we're going to do today is we're going to look a little bit at Health by Design's objectives as a company. We're going to talk about how they implement their best practice right at work locations. We're going to talk about some of the results they've seen as a company and how those results could really benefit the military health system. And lastly, we're going to get the chance to talk to their president, Mr. Rod Smith, and ask him some direct questions about how the company works.
So what are the objectives of this best practice? Primarily, the goal is to provide companies with a healthier workforce that's going to be happier and more productive.
Typically, how Health by Design implements healthcare for an organization is they look at the individual needs that that company has.
So we're here with the president of Health by Design, Mr. Rod Smith. So could you give us your elevator pitch from your perspective when you explain to people what is Health by Design?
Yeah, so it's one of those things that it could be pretty difficult and sometimes convoluted, because when you say you're in healthcare, that's so broad. I mean, it could be any number of things, right? So a version of our elevator pitch is that we believe we operate in a unique space of healthcare. This is the way healthcare should be done. And in doing so, we focus on primary care relationships and surround primary care relationships with ancillary services that make sense, building relationships to help people make behavior change. And in our mission, removing barriers to exceptional healthcare, transforming lives for God's glory, that it's through those relationships that we can see lives transform. The way we do it is partner with like-minded organizations and corporations and provide on-site clinics and near-site clinics, healthcare options outside of an insurance model. Mm-hmm. And in doing so, we can also tack on wellness programs, executive exams, health and nutrition coaching. We have 14 clinics. One of them is an executive exam center. 3 clinics are near-site clinic model, and the remaining 10 are on-site clinics. We have 8 different clients that support those 13 on-site near-site clinics, and we have over 25 wellness assessment clients and well over 50 executive exam clients.
Okay.
And because we believe that we're in the business of removing those barriers to exceptional healthcare and not letting anything stand in that way, we insist that our corporate clients, there's no copay. There's nothing that the member pays. They walk right in for free. All their labs, minor procedures in the facility are all covered, regardless of what kind of insurance they have. And that way, there's no barrier to receiving that exceptional health care.
So Brandon, could you tell us a little bit about how you think the military health system could implement some of the practices from Health by Design to make our public health and preventative medicine better?
Absolutely. So although we already have our clinics on base where our patients are located, we don't do a great job with our annual exam. So when you look at Health by Design's exam, they're looking at a litany of factors, doing in-depth tests, whereas we're seeing a med tech for 5 minutes and answering questions about our own health.
Exactly. So what you're saying is if we just took our preventative medicine and enhanced it through some of the ways that they do their health screenings, we could see some improvements.
Absolutely.
Awesome. As an officer in the U.S. Army, you had a direct experience with the military health system. So would you say there are aspects of Health by Design's delivery model that could actually be implemented to improve the military health system?
Sure, yeah, I think so. So one thing I would say in general is it's not so much what we do, but it's a mindset in which we do it that I think is the difference maker. And for the military, by and large, the constituency of the military are typically young, healthy folks on average. And even if they're not all that healthy or their lifestyle isn't all that healthy, that's not really the military's problem early on. And statistically, so few of the military proper makes it to benefits stage, access to TRICARE, elements like that. Mm-hmm. So if the military wanted to think like we do and shift that approach, I think what we'd have to see is the military getting ahead of care and costs that they don't have today. And if you really wanted to tackle that, you'd have to change the mentality of it. And that would be, okay, I know I may not inherit that problem, but society will. Mm-hmm. And if I don't help the people I have influence over in stewarding those relationships that I have access to and influence over today, then I'm missing the mark. Yeah. And if the military, as the biggest U.S. employer, or anybody else doesn't see it that way, all you're doing is transferring that problem to society or to the U.S. or to the community or to the healthcare system that's already broken and underserving us, and passing the buck. Mm-hmm. And if we don't approach it differently with a different mindset of how can we proactively enter into that relationship early to make a difference before they become somebody else's problem, all we're doing is chasing symptoms.
Mm-hmm. Can you explain to us what actually sets Health by Design apart from the other concierge and executive on-site clinics?
Yes. So one of the things I'd say we do is we build a model that is not corrupted by false metrics, mm-hmm. metrics that would undermine our ability to spend as much time with the patient as they need. In fact, we measure against seeing too many patients per hour because there's a sweet spot. Too few, not good. Too many isn't good. So, statistically, our metric is 1.5 to 2.5 patients per physician hour is our model. And we find our sweet spot. Being that it's relationship based, and that's what we're focusing on, you have to build the rest of your system around supporting that. Mm-hmm. We have credible doctors, but we spend time with our patients. Our patient satisfaction scores are off the chart. I mean, it's ridiculous. We're in the 98th percentile on patients reviewing us for the quality of care that we provide and how satisfied they are with the care. That beats anybody nationally, in industry or outside of industry.
So Ben, could you tell me a little bit about the outcomes that companies are experiencing from partnering with Health by Design?
Yes, so Health by Design screenings have actually caught 11 to 19% of their employees with critical health issues that would have otherwise gone unnoticed.
That's incredible. So what about some financial results?
So for example, in Valero, they've estimated they've saved between 20 to 25% in healthcare expenditures.
That's amazing. Squadron 10
Thank you for joining us today here at Health by Design, San Antonio's first and major concierge medicine corporation.
Thanks for joining us today over at San Antonio, Northwest San Antonio for Health by Design.
Now that we all have a better understanding of concierge medicine, thanks for visiting Health by Design with us.
Thanks for joining us at Health by Design's corporate headquarters here in beautiful San Antonio, Texas.
On here?
Yeah, we've got some curious deer, and these donkeys are about to come show them who's boss.
Who still say what's impossible?
It's a standout.